Okay, it's 11:35. I'm going to call the meeting of the CDC Executive Committee to order. Can we have a roll call, please?
Don Bastian,
Here.
Karen Briggs,
Here.
Edmund Cage, Lori Chassie,
Here.
Michael Childress,
Yes.
Michael Crandall,
Here.
Patty Guston.
Here.
Oops, sorry, I got the wrong person on here. How'd I do that? Sorry, folks. I have William Hennep, he's not on here anymore. Brian Krajewski, Lynn LaPlante,
Here.
Greg Schwarzy, Mike Todorovic, Yana Yu.
Here.
Okay, 1, 2, 3.
We have a quorum.
Form.
Yes. Do we have anyone sign up for public comment?
No.
First item then is approval of minutes for the regular meeting Tuesday, January 2nd.
So moved.
Second.
Any additions, corrections, or changes? All in favor?
Aye.
Opposed? They stand approved. Thank you. Next, committee vote required, item 24-1939, recommendation for direction and approval of the changes to the 2025-26 Community Development Block Grant Neighborhood Investment and Public Services Application Rounds and Application Solicitation Plan. I'm going to turn this, we'll get a motion in a second, but this is an item that we did receive a memorandum regarding the results of our outreach to both municipal and agency partners for our coming goals, et cetera. So I'll take a motion second, then I'll let staff explain this thoroughly.
Motion, and move to approve or second, whatever you need.
I need a motion.
Motion.
Second, thank you.
Okay,
Discussion.
Take it away, Julie.
Take it away, Julie.
Who was the second?
Mike Crandall.
Okay.
I do have a brief PowerPoint that I'm gonna go through just to give you some visuals and explanation as to the outreach that we've done. Next slide, please. Okay, so as Lori said, this is specifically for Community Development Block Grant Program applications, as well as Emergency Solutions Grant applications, which are kind of attached to our public service, CDBG public service. So just to give you a little bit of background on CDBG and ESG funding, for 2024, you can see we received just over 3.6 million in CDBG funding, which covers all of the programs that we administer. And then Emergency Solutions Grant funding, just over 286,000. And then there are some regulatory caps or percentages that I also wanted to point out, just so you're aware. CDBG, admin and planning, the maximum that we can spend is 20%. And then for public service projects, the maximum we can spend is 15% of our total annual allocation. And for ESG, there's a maximum of 7.5% in admin and planning available and a maximum of 60% specifically for street outreach and emergency shelters. Next slide, please. So Community Development Block Grant Program funding is specifically designed to serve those that are low to moderate income. So since we're proposing applications for neighborhood investment projects and public service projects, I just wanted to provide a little bit more detail about what that means. So for neighborhood investment projects, they have to be located in and primarily serve those that are considered low to moderate income. DuPage County is an exception criteria community. Typically, CDBG requires 51% or more low mod in the census tract block group area and service area, but DuPage County is at 43.1%, and that will be effective as of August 1st, 2024. So what does that mean? That means a project would have to be located in and serve that particular percentage of low to moderate income individuals. Or you could complete an income survey as one of our municipal partners, which would gather specific data, use very specific HUD-approved methodology, where you would have to demonstrate that you're serving an eligible population that is low to moderate income. For public service projects, you have to serve at least 51% low to moderate income individuals within your program. So how do we do that? The program could serve a presumed benefit group as listed on the slide, or you have to collect information on family size and income as part of the program. Next slide, please. For Emergency Solutions Grant overview, ESG funds specifically serve and support those who are homeless or at risk of homelessness. And there's 5 specific categories that are called out in ESG regulations: street outreach, emergency shelter, homeless prevention, rapid rehousing, and HMIS, which is the HUD required system that we report in. So there's a little bit more information on the slide about what falls into each of those categories. Next slide, please. Okay, so now all the outreach that we've done. So we are in the process of preparing our next 5-year consolidated plan, which will cover program years 2025 through 2029. As part of the consolidated plan process, we are required to do robust outreach and engagement with the community and interested stakeholders. One of the things that we've done was put out a survey opportunity for residents, our nonprofit partners, our municipal partners, and that was solicited from May 1st to May 31st of this year. You can see we've received a pretty decent response rate. Really excited about what we received from our community partners. 366 of our English surveys, 21 of the Spanish surveys, and then 52 of our nonprofit surveys and 26 of our municipal surveys. Next slide, please. So these next few slides are going to show you exactly where the needs kind of fell based on the responses from those surveys. So sorry, that's very difficult to read, but the community needs survey results for greatest area of interest were housing. So that first one is affordable housing, rental and homeownership. Sorry, I'm gonna go closer to the screen so I can read it to you because I can't even see it from that far. The second highest response rate that we received was for public services in general. So nonprofit agencies providing services for the community. And then the third highest was homeless prevention or homeless services. I'll just keep going, followed by infrastructure and then followed by economic development and then followed by public facilities. Next slide, please. And then our Spanish survey results also very heavily focused on affordable housing. The next highest was public services, then economic development, homeless prevention, homeless services, public facilities, and infrastructure improvements. Next slide, please. Then we asked a question about, okay, if you've identified public services as a need, what are the top 3 public service needs that you feel are necessary to serve low to moderate income residents within your community? So our English survey results focused on mental health services, food pantries, and senior services. And then the list goes down from there. If you would like me to point out anyone individually, let me know.
What's the fourth one?
The fourth one is public transportation services. Next slide, please. Spanish survey results, employment and workforce development was a top need identified, youth services, public transportation services, and then food pantries. Next slide, please. Then we also asked them within housing, what are the top 3 housing needs that you feel are necessary within your community for low to moderate income individuals? Affordable housing family rentals was by far the highest need, followed by affordable housing home ownership, affordable housing senior rental units, and then the fourth is in-home caregiver or respite services. Next slide, please. And then for the Spanish survey results, affordable housing rental family units was the highest. Down payment and closing cost assistance was next. Permanent supportive housing and energy efficiency programs were kind of tied, I guess. And then affordable housing senior rental units and affordable housing ownerships was the next tied category. Next slide, please. Okay, so our nonprofit outreach was structured a little bit differently. Our nonprofit partners are obviously those that are providing these services and serving these clients. So what we did within that survey was we asked them to provide us with information on what they believe the highest needs are within the community for specific categories. So critical public service needs, homelessness prevention needs, housing needs, employment needs, health needs, and then we also did ask for capital needs of their building. But now we also wanted to know if there's high needs within the community within these categories, what services are already available, right? Because we really want to identify the gap that exists within DuPage County serving these clients. So that's the second aspect of each question is the highest critical needs and now what's most available within the county. Next slide, please. So this is to give you just a little bit of a visual as far as what that need versus availability difference is. So our nonprofit partners identified rental and mortgage assistance and housing navigation services as the top needs. So we kind of look at that holistically as housing services for this, for the purpose of this survey and for our application process. The next was behavioral health services. And then the next four categories kind of tied for the third highest, I'd say youth services, services for persons with physical and developmental disabilities, and then mental health services. Anything that is below this bold line or has a zero negative number, what that means is there's a need, but it's already basically being addressed by services that are available. And some were determined by our nonprofit partners to have like an abundance of availability per se versus a need within the community. So when we were factoring in all of this data, we really had to take a critical look at what the community feels is that high priority, right? Based on the slides that we just went through versus what's actually out there and our nonprofit partners are already providing. Next slide, please. And then for our municipal needs, we also put out an a survey, and we asked them to identify and prioritize their public facility and infrastructure needs, economic development needs, and then we did ask them to also address natural hazard risks and climate change for vulnerable residents within their communities. Next slide. And then this gives you another visual of kind of where those needs fell within our municipal feedback that we received in those surveys. So highest priorities from our municipal partners are water and sewer improvements, street improvements, sidewalk improvements, and ADA compliance, followed by parks and recreational facilities, flood drainage, tree planting, so on and so forth. The lowest needs were in the economic development category, as well as historic preservation, and no one seemed that interested in solid waste disposal. But remember, it's low mod, right? So it has to be very specific for CDBG.
Julie, what's the orange versus the blue?
Oh, sure. So, sorry, it's very difficult to see. So blue is what was identified as a high priority. Orange is what was identified as low priority. And then NA, that means they don't have a low mod area that they could implement that project, right? So yeah, a lot of stuff to consider. Next slide, please. We also completed focus groups as part of our outreach efforts. And we were able to go to 4 agencies and have 5 focus groups. And this just gives you a little bit of information on each of those groups. Next slide, please. Okay, now to the fun part. So this is what we're proposing for our 25 and 26 application round. Neighborhood investment applications is one of the rounds of funding that we would like to make available. So on the left, I provided an overview of what was eligible in our 2022 to 2024 application cycle. And then on the right, these are the proposed changes for our 2025 to 2026 application cycle. So really the biggest change is removing community-wide facilities because our municipal partners did not indicate that they have prioritized that or have low mod areas in which they are going to build a community-wide facility. Removing planning studies, historically, we have not received planning study applications. And for planning studies funded by CDBG, it has to specifically relate to a CDBG or cross-cutting requirements. So for example, a fair housing plan or a multi-jurisdictional plan related to CDBG funding. And then the next piece is to incorporate scoring for projects that address the community's vulnerability to climate change. Within our our survey responses from our municipal partners, we did receive feedback specifically related to that question. And some examples that they gave of needs were combined water and sanitary sewer separation projects. I have other ones written down, but they're blanking. Green infrastructure projects would of course be one of those, so that permeable pavers can be part of it. Within a park, you could do covered shelters to provide some shelter from the sun, misting stations at a public park. So those are some examples of what would fall within that category. And we would ask our municipal partners to identify that within their scope, and then it would be scored based on whether or not they are able to address climate change within the community. This is also a sticking point for HUD. So within our consolidated plan, we are required to address what we're doing about climate change, right? Because something that HUD wants us to pay attention to, and with federal resources, it's important that we're paying attention to how we can address those within projects that we fund. Next slide, please. And then for public service application changes, same concept. On the left is what we included as eligible applications within our 23 to 24 application year, and then the right side is what we're proposing for 25 to 26. So for our last application round, and we believe that it's in part due to the pandemic, there was really a shift on providing supportive services to homeless individuals or those at risk of homelessness. So our last application cycle really focused on all things homelessness prevention, including emergency shelter, legal assistance for those that are homeless or at risk, financial resources specifically for homeless, foreclosure prevention, and then tenant-based rental assistance for homeless or those at risk of homelessness. Based on the feedback that we received from our outreach with our nonprofit partners and the community, we feel that the needs have shifted. So what we are hoping will come out of today, or what we need to come out of today, is guidance on how the committee would like us to target our public service funding and our public service applications, keeping in mind that there's a 15% cap, which is about $500,000 to $530,000 that we have to work with, and the types of projects that we would be able to fund. So the first option, also as a reminder, our public service applications are specifically salary and benefit support for staff that are running these public service programs. So this money wouldn't be to create new housing or construct housing. It would be to support staff that are doing, let's say, housing navigation services or administering rental support from another program, but are providing that case management or wraparound support. So option one is to focus on those housing services that we saw was the highest gap from our nonprofit surveys. That could include housing navigation, rent or mortgage assistance, case management, focusing on housing support or wraparound services, and then TBRA administration, which is a tenant-based rental assistance program that provides rental support, but then also is trying to encourage and gain self-sufficiency for that recipient of TBRA. Option two, housing services and behavioral health services. How did we get there? Because behavioral health was that second highest gap when we look at the housing as the top and then behavioral health is the next one. And then option three, since there were a bunch that tied, it can't really break it out much other than housing services, behavioral health services, and then the rest are those ones that kind of came in even: youth services, services for persons with disabilities, and then mental health services. Next slide, please. And then just so you're aware, our potential future application rounds would follow this schedule, assuming nothing crazy happens within the world and we don't get other money. But so 2024, we would be reviewing applications this fall for public service, ESG, and CDBG neighborhood investment. And then in 2025, we would be asking for applications for 2026 capital projects funded under CDBG. And then in 2026, we'd be looking for 27 to 29 public service, ESG, NIV. And then 2027, we'd be looking for 2028 projects that are capital. Next slide, please. I think that's it. That's it. We did it.
Go back to the slide that has the three options on it.
Yes.
Yes,
Yeah.
and a quick platform question here. Could you address, or just mention the ESG?
Oh, yeah, absolutely.
Thank you.
So,
And the
that's-
impact of
that
this
is
on
a
the-
great question.
Thank you.
Or comment. So our CDBG public service and ESG applications are kind of combined. Our ESG applications are specifically to support homeless or those at risk of homelessness within those 5 categories. So we don't have any proposed changes for ESG, which is why it wasn't highlighted on there, but there is that pot of money that already serves homeless or those at risk of homelessness, specifically through the Emergency Solutions Grant Program.
I'll also add that through the Illinois Department of Human Services, the county, the geographic area received an increase in homeless prevention services and has now added, through the homeless continuum of care, we have added legal services for individuals at risk of homelessness we would be dropping it in CDBG, but it's been picked up by IDHS.
Yes.
So I think the Supreme Court changed the law on people who are living homeless on parkways, in parks, on streets and things like that. Is there some conduit to be able to help those individuals find housing. Because potentially there are gonna be municipalities and villages that are going to enact the new law, which is to transition from street living to home, house living. Do we have any mechanism in place or funding? I'm assuming it would fall under the housing services options, which are all in 1, 2, and 3 option, but I'm not sure.
Yeah. So, that's basically what the street outreach workers at DuPage Pads do, is they go out and they work to engage individuals who are unsheltered homeless, to encourage them to accept services and when space is available at the interim housing center, to encourage them to come and stay at the interim housing center to stabilize their housing. These funds can't be used to actually like provide, to buy a building, the CDBG public services we're talking about, you can't lease apartments with it. Like, that's not something that we can do with it. So it's not going to create more housing for the public services. It's going to get people connected to housing that exists. But street outreach workers do exactly what you're talking about, and that they're going out and identifying people who are unsheltered and working to engage them in services.
And now I was talking to city ward committee person, and she was sharing with me that Aurora has a big influx of homeless individuals. And I don't know if PADS goes into Aurora. I know a
No.
portion of my district is in Aurora. But like Hesed House, I think, is in another county. So I'm just trying to think out of the box, how people can get care. Now, I notice you have mortgage assistance. Is that like, how does that work? Is that a down payment program to help with their mortgage, or they already have a mortgage and it helps them stay in the house, or how does that apply?
So that would be based on nonprofits that already provide that service. So I don't know of a nonprofit that does mortgage assistance payments currently. I know our Home DuPage organization provides foreclosure prevention, financial education, and they will guide homeowners who are at risk of foreclosure or potentially in that foreclosure process to available resources. But I'm not familiar with a nonprofit organization in DuPage County that specifically does that, which could be why that gap exists, right? So it is possible that a nonprofit partner could apply to create that program and use CDBG public service funds to create a new position of an employee that would do that, and we could support that employee with partial salary and benefit support through the program.
And so our support would be on the educational component that potentially that employee would want to do. It doesn't
not
it
paying
doesn't
someone's
hit
mortgage.
it doesn't
Yeah.
help it helps, but it doesn't go directly to the client.
No, I like to think of it as the case management support, right? That's pretty much what we're targeting when we're doing public service projects. That case manager who's providing all those resources and guidance or wraparound services for their clients so that they can be housed, stay housed, things of that nature.
Anyone else? Yes.
So I'd like to go back to this application changes overview, because really we're looking at option 1, option 2, and option 3, right? That's ultimately what
Correct.
we're looking to get a vote on, yes?
And agreement with our neighborhood investment changes as well.
Right. So I'm just looking at your memo, and it says option 1 is focused on the highest priority needs. And so I'm just wondering, the option 2 and the option 3, how are they really different from option 1 if the highest priority needs are option 1? So I just want to get the understanding of why do you want to have an option 2 and an option 3?
So great question. I didn't want to limit it to one category based on there being gaps in other categories. So that's why I was hoping to present it to the committee to get feedback on, should we target the highest needs, which would be my personal opinion is all things housing. We should focus the money in housing. We have 15% only of our CDBG allocation. We should really be narrowing our focus for our nonprofit partners, especially if that's the biggest gap that they identified. but I didn't want to rule out other categories, specifically behavioral health, because our community needs surveys also showed that as something that they were interested in or felt that that was a gap that they weren't receiving assistance in. So basically I went 1, 2, 3, and 4 kind of were together. So the youth services, persons with disabilities, and then mental health services, those were kind of all the same gap score, if you will. That's why I gave 3 options. But you are welcome to guide us in whatever way you feel is best. I would say housing, if it were me.
And again, this is to support the positions
Yep.
that will connect people to those resources.
Right.
Well, and I do know at the county board and the county chair, we're focusing also on mental health. So I'm not sure I don't think I would. I mean, if we can put mental health up in option 1, youth services, that would clinch it all for me. But I do think those other things are important.
Could you go back a couple slides? Sorry, to the one that has like the needs and availability. Keep going.
Can I ask a clarifying question, Julie? How are we differentiating behavioral health and mental health?
Yes.
And I'm sorry, I didn't catch that before.
No, that's okay. So
Do we have a description on the survey?
no, there wasn't a clarification in regards to the survey. But interestingly, there showed like the response from our nonprofit partners is that there's that a little bit of a difference in regards to which one has a gap.
We'll go to you now.
Thank you very much. To your point that you made that for what your recommendation is, I also agree with you and think that we should be really focused on what the purpose is of these grants. We have other committees, the CRC is being built, like there's other people that are leading the charge there. Sometimes I think by trying to do too much, we might dilute our efforts to where they are not as impactful or as efficient as they should be. So, sort of jack of all trades, master of none approach. I think this is our area. This is what we focus on. This is what these grants are meant to do. And we keep a laser-like focus on that.
To add on to that, sorry, it's also just very important to remember the regulatory requirements of CDBG. So mental health and behavioral health is not, it doesn't just impact low to moderate income individuals, right? It impacts everyone. And our funds can only support those that are primarily low to moderate income. So not to say that there isn't that population as well, but we very much so have to stick to the regulatory piece where it's primarily low to moderate income benefit.
That's the task before us.
Right.
And I think
Absolutely.
to doing something else dilutes our task and we're not doing our job appropriately.
I had dilution. as well.
There we go.
So there
And I guess my point too would be then, why do the study and have anything with respect to mental health? Because if our focus is purely on the CDB grants being for, what's specified under the federal government, then why even incorporate mental health or behavioral or anything else? If it's not relevant, then why even have a study on it? We all know what we have to spend the money on if it's regulated by the federal government. I guess, so I'm kind of confused. And that's why I'm like, well, if we're gonna do this, maybe we should add some initiatives into this that we're addressing and, at the county board level. So, I don't know. To me, the more help we can give in different places, the better it is. But there are people that want to hone in on one thing, and that's fine too. I would just make sure that we're complying with whatever the federal government is allowing us to fit in that silo.
Just from a municipal representative standpoint, I think that the survey helps guide in a broad way, particularly to our not-for-profit partners, some of the other areas that they can focus on separate and apart, because many of them have programs that extend well beyond what we are able to support as CDBG funding. So I think it's nice to have that information. And I know in option 1, and I agree, I've been here for quite a while and I've seen us try to be all things to all people, and it gets very complicated. And I think if I'm understanding this memo, essentially we're sort of shifting post-pandemic to helping pay for actual housing to helping to support efforts to assist with housing permanency, which I think is a huge piece for the future, particularly of what we're trying to accomplish here. And if we accomplish that through addressing those highest priority needs first and foremost, I think that's where we need to be.
Housing it is.
Yeah,
Yes, ma'am.
I just wanted to say that, according to the graphs, I would have to agree. I mean, it showed that housing was the greatest need. It was the greatest thing that they thought that we should be concentrating on with these funds. So I too would agree with option one. I think, and I'm a big mental health person, but I think that the role of this, as member of the plant said, Chair.
Chancy, it's okay.
Thank you. Sorry,
Okay.
not usually on this one. So I think we do have to really just pinpoint, because I think that housing right now is a huge, affordable housing is a huge need in DuPage County right now. It's something I hear about all the time, and I'm sure my other board members do too. So that would be the one I would be directing the board.
I'm going to jump in and say we haven't heard from all, certainly willing to take comments from any additional members, but I'm starting to hear a consensus towards option one. Am I hearing this correctly? And if so, I think we would entertain a motion to make that our direction.
That's one question.
Yes, please.
Oh, thank you. Are there any unintended consequences that if we do option one, instead of, option two or option three? So let's say because this is about payroll, right? This is about paying for expenses, the nonprofit organization, I guess. So I'm just wondering if they would have a problem with, if we were just to focus on the money for this, but they also happen to do behavioral health or mental health or anything, will that affect their ability to apply for, these kind of funds? I'm just wondering if there's any unintended consequences.
I would say if they have a program that supports the housing needs, right, navigation, case management, the wraparound services, then they can target that application for that staff member.
Okay.
And then there are other programs, typically they would be absorbed by other available funding.
Okay.
Or sources that serve, or are more flexible and aren't focused on the service.
Right.
Yeah, I also think, unfortunately, that is sort of the world nonprofits work in, that they know that, and that's actually one of the reasons we're doing a round of applications for 25 and 26.
Mhm.
So the agencies that do get funding know that they have it for 2 years. Also, the timing is such that we'll be taking these applications in August or September, something like that, for funding to begin next April. So the agencies, if they're doing something that we're currently funding that will no longer be funding,
Mhm.
they will have about a 6 or 8 month ramp to understand that, that funding is going to end at the end of March. And then, and like I said, unfortunately, that, from working with nonprofits, that's sort of that's the world they live in is, grant opportunities come and go and priorities change. And I don't think anybody, I certainly don't think anybody would criticize us for focusing on housing. It's unfortunate that we can't do everything, but I think everybody will tell you housing is a priority, so.
Well, I'd like to make a motion on option one. Focus on the highest priorities needed by accepting applications for programs that provide housing services, including housing navigation, rent or mortgage assistance, case management focusing on housing support, or support for TBRA administration.
Thank you for that. I thought I saw a second. Member you. This will require a roll call vote.
Okay. Right. Eddie Preston,
Yes.
Jeannie Lou,
Aye.
Don Ashton,
Yes.
Karen Briggs.
Yeah.
Lori Chassie,
Aye.
Michael Childress,
Yes.
Michael Crandall,
Yes.
Lynn LaPlante.
Aye.
Let's see. Nope. I checked Mike Todorovic, but he's not here. Okay, that's it.
Thank you. That stands approved.
So we also need a motion on the changes to the municipal neighborhood investment, which the recommended changes, if you recall, are removing planning studies from the application process, removing community-wide facilities, right? And adding a component of addressing hazard mitigation related to climate changes.
So moved.
Second.
Did you catch that?
I'm slowly catching it.
Guston and Childress.
Guston and Childress. There you go.
Okay.
We'll take a roll call on that as
Lynn
well.
Weston? Yes. Michael Childress?
Yes.
Don Bastian?
Yes.
Karen Briggs?
Yes.
Lori Chassie?
Aye.
Michael Crandall?
Yes.
Lynn LaPlante?
Aye.
Amy York? Aye. Did I miss anybody?
That stands approved. Thank you. Am I good then?
I think so.
Any other business for the committee today?
Julie, will we have items to bring back in August related to this? Will we have an August meeting? I'm just thinking, is this March's last meeting?
Well, no, you're gonna be here for September, right? You're not calling in sick that day.
I don't know what day of the week the third
Desperate
is.
state.
It's Tuesday.
Yeah, okay, all right. Okay, never mind then.
Okay. Well, unless we hear otherwise, our next meeting is August 6th, right? Unless we get our cancellation notice. That's okay. There's no other business. We'll announce the next meeting. You need a motion to adjourn.
Some of them.
Second, all in favor? Aye. We stand adjourned. Thank you so much.
Thanks, Lord.